Hello, everyone, and thanks for joining us today for our webinar, Words Matter, Simplifying Clinical Terms for Patients. My name is Jordan Leibovitz, and I'm part of the marketing team here at IMO. Today, we have two presenters speaking, Whitney Mannion. She is a senior clinical terminologist at IMO, and David Bocanegra, a nurse informaticist here as well. So now we can get started. On today's agenda, our panelists are going to be speaking about why there is a need for patient-friendly terminology, what the current status quo around patient-friendly terminology is, how can patient-friendly terminology be done better, the benefits of patient-friendly terminology for patients and providers, and then what are we doing at IMO regarding patient-friendly terminology with an IMO Core Peri app. And then lastly, we're going to do a Q&A quick discussion as well. So for now, I'm going to go and pass it over to David.
So what's the 411 on health literacy? Health literacy is the understanding, motivation, and ability to find, comprehend, evaluate, and apply the information needed to make informed healthcare decisions. Literacy plays a vital role in healthcare. A person with poor healthcare literacy is immediately at a disadvantage. They just won't be able to understand and navigate today's complex healthcare system. According to the Milken Institute, up to 88% of the US adult population has low healthcare literacy. In addition, a lack of basic understanding of instructions or poor communication between patient and physician often contributes to non-compliance with treatment regimens, causing adverse effects on the individual's general wellness, not to mention the increased financial burden on the patient as well as the healthcare system. So as we said, at least 88% of adults living in the US have inadequate health literacy. So let's talk about what that is. There's two definitions: personal healthcare literacy and organizational healthcare literacy. Personal healthcare literacy is how individuals seek, comprehend, and use information or services to inform health decisions. Organizational healthcare literacy is the extent to which organizations equitably allow individuals to find, comprehend, and use information to inform their healthcare decisions. These explanations recognize that organizations are responsible for equitably improving health literacy, and that health literacy depends on what the information is and how an individual will use that information. The ultimate goal is for people to use health information and not just understand it, and then make well-informed decisions with that information. Unfortunately, physicians and nurses encounter problems daily caused by inadequate health literacy. Among these are issues with poor understanding or the improper use of medicines, a flawed understanding of the importance of diagnostic tests and procedures, or communication problems resulting in wrong or incomplete past medical histories. With all the information available today, personal health literacy is essential. As the healthcare system evolves, it's becoming more complicated for patients and physicians. Healthcare delivery and patient care have changed in a way that demands that patients navigate an increasingly difficult path to care coordination. For example, patients might have had one doctor in the past, but now are likely to see several specialists along with their primary care physician regularly. In addition, patients have access to all their health records online. This increases transparency and accountability, but it also adds more information that they have to interpret. Determining the patient's health literacy is essential, though. This cannot generally be assessed by asking the patient whether or not they understood the discussion, as many factors come into play here, such as education level, ethnicity, cultural differences, and the like. Furthermore, the question itself can cause stress for patients who don't fully understand, but are too embarrassed to admit it. Surveys have repeatedly shown that low healthcare literacy among adults is associated with other detriments and health disparities. These people are generally in poorer health, and they lack resources, often just because they don't know that the resources exist. So institutions really need to be faster to recognize the requirements of people with different levels of understanding. And the easiest, probably the most obvious way to begin improving health literacy is to examine the terminology that we use when we're interacting with patients. I'll turn it over to my colleague Whitney now, so she can explain what we mean by patient-friendly terms.
Thanks, David. Yeah, so why do we need patient-friendly terminology? First and foremost, medical language is confusing and often contradictory. Some examples are that a positive test result can have negative implications. And an impressive X-ray doesn't have anything to do with inspiring a radiologist. And a tumor progressing is actually not good news. There's been numerous studies that have revealed that medical terms are readily misunderstood by patients. And there's many factors that come into play, including level of education, language barriers, electronic access to patient data, and particularly with education level. You can still have a high level of education with a master's or even a doctorate degree, but then you're still in the dark when it comes to medical language. And so just having access to their healthcare data actually doesn't mean that patients can interpret everything that it means. More simply put, words matter. And words used to communicate with patients must be carefully considered to ensure that individuals truly understand their diagnoses, treatments, care plans, and costs. And health literacy is closely related to health equity. Health literacy, again, refers to an individual's capacity to obtain, communicate, process, and understand basic health information and services to make appropriate healthcare decisions. And health equity refers to the fact that everyone has a fair and just opportunity to be as healthy as possible. So in a nutshell, health literacy makes the information more clear, and health equity makes it more inclusive. They coexist, and an investment in one is really an investment in both. And organizations that carefully consider both when developing their communication products will more easily achieve success in their public health interventions. There's also been some recent regulatory changes around information blocking. Most clinical information is digitized, accessible, and shareable thanks to several technology and policy advances, making interoperable electronic health record systems more widely available. And anything that impedes the access, sharing, or use of electronic health information is referred to as information blocking. In 2016, the 21st Century Cures Act included provisions to promote health information interoperability and prohibit information blocking. And the Cures Act final rule focuses on supporting the use of modern technology and IT in healthcare. It aims to give patients essential data in the electronic health record by removing barriers created by health IT developers, which often impede the sharing of information. The rule also requires the adoption of standardized processes for exchanging information and provides patients with more control and access to their medical records. So even though legislation has been enacted, healthcare organizations are still slow to adopt and develop their own patient-friendly terminology.
Yeah, thank you, Whitney. So the status quo is exactly that. I mean, with all of these, this legislation and policies being written in place, it tends to still not be a priority for most healthcare providers, as they have other things just higher on the list that are more important. And then there's a lot of obstacles to just tackling this project in general. Linking technical terms and medical terms to more terms that are more accessible to patients is not an easy task. You have to just make sure that there's a clear understanding across the spectrum, taking into consideration education level, ethnicity, culture, things like that. But it's real important because the ability to gather data and analyze data is crucial to measure the impact of the efforts to improve health literacy. The type of data you collect is important too. Many healthcare organizations find that it's more important to collect the data that reflects how patients interact with the content that's being provided and those recommended resources. Which resources are heavily used, which ones don't seem to be used at all, which ones clearly are ones that patients don't like. By collecting data at this level of engagement, organizations could continually assess and revise policies and content as needed to achieve more successful outcomes. But as with many things that are important to do, the task is easier said than done, because it's not enough to just collect this data. To affect a change in health literacy overall and patient outcomes, et cetera, the organization has to be able to integrate this data into the EHR, into health IT systems. And much like the process of connecting clinical terminology to standardized code sets for billing purposes, et cetera, there are a number of obstacles to linking technical and medical terms to ones that are more accessible to patients. And this exercise itself would be daunting. It would require, among other things, a deep clinical knowledge, a significant investment of time and resources. And then after you kind of review everything and get it all matched up, then there's the maintenance aspect of it. You got to make sure that it stays clean and stays friendly for your patient population. You know, every time you put out a new pamphlet or add a new page to your website, all of these things would have to be continuously reviewed. And then after you have this content where you like it, you have to decide how to implement it into the HIT systems that are available to you where it's going to make the most sense. So it's quite clear that we can do better. And I think that first we have to realize, as I said before, the many upsides of leveraging patient-friendly language are usually more straightforward than the implementation of these strategies. Then an organization is basically going to have to take a universal precautions approach and review all the medical terminology that they have in patient-facing handouts and portals and make those necessary changes. And those changes could encompass hundreds or possibly thousands of words and phrases that would require review and comprehensive mapping to standard, understandable clinical terms. However, once this work is complete, these new terms could populate patient-facing resources and technologies such as the patient portals. They could be used in a lot of EHRs have the facility to send out automated text messages or automated emails. Website content goes without saying. The billing department, medical bills, when people understand their bills better, they tend to be faster to pay them. And then, of course, check-in kiosks and things like that. So when we start examining this terminology, there's a few recommendations that seem to be universal when you're trying to develop strategies to improve health literacy. And the first and foremost, use plain language. Now is not the time to show off your medical knowledge. Just use plain language and make sure that the important points come first. Like they say in the newspaper business, don't bury the lead. Make sure that you've got that important information right up front, because if a person is already uncomfortable with healthcare jargon, you're going to lose them after the first paragraph or two. Break down complex information to be more understandable. Don't just have a pamphlet that says understanding your diabetes. That's going to be way too much. Maybe have a series of pamphlets or handouts that, why it's important to check your blood sugar regularly, how diet and counting carbohydrates helps your blood sugar. And then by understanding all these bits and bytes and putting them together, of course, the obvious goal would be that the patient ends up with almost a clinical level of understanding of their condition. When you're providing all these pamphlets, make sure you're using simple language and define or ensure understanding when you do have to use medical terms within that content. Of course, visual aids are always helpful. And then probably one of the biggest hurdles, but the one that's going to be the most effective, is to recommend and use technology. Have the patients, maybe have a training program so the patients know how to use the patient portal. They know what to go there for, what information they're going to find. Telemedicine, mobile apps, all of these things can help connect the patient to the provider much more effectively. So the benefits of patients for patient-friendly terms, they're pretty self-stated. I mean, patients who understand their care are more likely to follow their care plans. They're more likely to comprehend their medical bills when they have a good understanding of their health situation and their medical problems. There's a reduction in stress, right? And then this will also allow them to be more informed and prepare for future procedures and make good decisions overall. The federal government developed and published official guidelines in the Plain Writing Act of 2010. And these guidelines were first developed in the mid-90s and they're revised regularly to provide updated direction on clear communication. And the goal of this initiative, and this is all a variation on a theme, but it's for people in general to find the information they need, understand the information they find, and then be able to use this information to meet their needs. So patients with a higher health literacy will readily accept and use patient-facing healthcare IT solutions. They will also recognize the advantage of having immediate access to their medical information and other benefits, such as self-scheduling their own appointments or diagnostic testing. But all in all, putting this information into the hands of the patient and ensuring that they fully understand how to interact with these various tools helps them stay involved in their care to maintain wellness. And then obviously, if there's benefits to patients, there's benefits to providers for patient-friendly terms. There's going to be less misunderstanding between the doctor and the patient. Misunderstanding can cause a lot of back and forth, a lot of emails and messaging back and forth. And when a patient has a clear understanding, it'll reduce the need for all of this follow-up calls and email. Once again, when patients understand their medical bills, they tend to pay them more promptly. And all of this is just going to improve the patient experience overall. Excuse me, I'm sorry. And so there's a multitude of benefits for patient-friendly terminology from a provider standpoint. Research has shown that people with higher degree of health literacy are likelier to use preventive health measures and tools. And this is not only going to improve the general wellness of the patient overall, but increased literacy and wide adoption of these tools will have other impacts that will decrease some of the burdens on the healthcare system. For example, health literacy can prevent or reduce unnecessary emergency room visits. It can decrease preventable admissions or readmissions to the hospital. Patients who don't fully understand their medications can have issues with dosing errors. And some medications they have to be taken at a specific date or time, or with food, without food. There's certain blood pressure medications where it becomes dangerous to drink grapefruit juice. It can cause severe hypotension. So we can see this lack of detailed knowledge can be dangerous. In addition, certain chronic medical conditions such as diabetes or HIV/AIDS and others almost demand that the patient be highly literate just to manage their disease correctly. So it becomes evident how a high degree of health literacy will improve health outcomes. And also in leveraging these strategies, we also will improve quality by confirming that patient-facing materials are safe, they're effective, they're patient-centered, the information is equitable and delivered in a timely manner. These are all the hit points for a continuous quality improvement program. So we all know that when quality is improved, then so does satisfaction. So, obviously that's the goal with an interaction. We want a high level of patient satisfaction. I'm going to turn it back over to Whitney so she can tell you how IMO helps with all of this.
Thanks again. So how can IMO help? As David mentioned earlier, up to 88% of the US adult population has low healthcare literacy, and adults with low literacy are known to be in poorer health and less likely to use technology and essential patient engagement tools. Poor communication between the patient and physician can lead to a lack of understanding of instructions or often contributes to non-compliance with treatment regimens. A patient must be able to understand their health conditions and use information and services to make informed health-related decisions and take appropriate actions for themselves and others. Understanding backgrounds and health literacy needs are critical to ensure that patients understand their health conditions and ultimately have better patient outcomes. And to date, mostly patient-friendly terminology has focused on problems and diagnoses, but IMO has decided to curate patient-friendly terminology related to surgical procedures. So IMO is trying to bridge that gap between the standardized terminology for surgical procedures and is using words that make sense for patients. Every surgical procedure we have developed a patient-friendly translation for has been carefully considered by our clinical team, which includes former surgeons and operating room nurses. Generally, we've aimed to meet a 5th to 8th grade reading level in our translations. And you can see the technical name for the procedure being performed is in the left, the blue box on the left, and the corresponding patient-friendly translation is in the green box on the right. So tympanoplasty is the technical name, and operation to repair eardrum is our patient-friendly translation. Likewise with cardioversion, that translates to procedure to correct abnormal heart rhythm using electricity. And then that last example for patelectomy, our translation is operation to remove patella. And you can see that kneecap is in parentheses after the word patella. And this is our attempt to educate even within that patient-friendly translation itself. And that pattern of parenthetical explanations is something that we have in many of our translations that the clinical team developed. If you want to go to the next slide, perfect. So by integrating IMO patient-friendly translation from terms intently built for clinical and operational workflows, organizations can streamline how their data contributes to informing patients about their care. The goal is for these to be displayed in patient welcome kiosks, the patient portal, and in reminders and emails. You can see in that additional example where instead of the patient seeing the more comma delimited format description of lymphadenectomy, comma inguinal, they would instead see operation to remove lymph nodes of groin region. And that's a much more plain language explanation of what that surgical procedure is. The hope is that this greatly increases a patient's capacity to obtain, communicate, process, and understand that health information, and it empowers them to make appropriate health decisions and be more involved in their care. So patients understanding what surgery or procedure they're having is critical to their care, and evidence has shown it will help them be more involved in their healthcare, have better outcomes, and have overall improved patient experience.
Awesome. Thank you so much, Whitney and David. That was great. So at this time, we'll be launching our Q&A session. So any questions that you had coming into this webinar, please enter them now and we'll begin answering them live. Just please excuse any brief silence for our team to review and answer them. I see one came in. So this is for Whitney. Are IMO's patient-friendly translations suitable for surgical consent forms?
That's a great question, but unfortunately, no, they really lack the requirements that would be needed to populate a surgical consent form. The use case that we developed all of our translations for is really for patients when they're at the welcome kiosk and in the patient portal.
Perfect. Another came in. Are there any character limits in how long the patient-friendly terminology description can be?
Yep, there is actually. It's a limit, and the limit in that field is 254 characters. And we took special care to make sure we didn't exceed that in our translations. I think there was only maybe one or two where we had to edit it to make sure it fit within that range.
Okay. Another one came in. Do you have a patient-friendly description for every single surgical procedure?
I would say that is definitely the goal eventually. As of now, we've developed a patient-friendly translation for the top 3,000 surgical procedures. And we base that off of the frequency that those surgical procedures are used by our customers. And as we developed the top 3,000, we also made some editorial rules to kind of govern how we would create future patient-friendly translations. And we're continuing to create more since we're rolling out this top 3,000. So the goal is to eventually have a patient-friendly translation for every term in our peri-op IT surgical scheduling solution.
Awesome. Another question came in. How do you get staff and physician buy-in about health literacy?
Yeah, I think it's just important to get buy-in on anything, you have to explain the importance of it. And I think that is probably the issue that's going on these days. You know, people in healthcare are generally healthcare literate, and so they don't see the issue as it truly is, in the community. So I think that it's just real important to just understand that it is an issue, and the depths to which that it can cause ill effects on patient care and patient outcomes.
Okay, another one is, do you have any software to elevate the reading level or evaluate the reading level of documents? We use Readability Studio.
That's a really good question. And I would say that was probably one of our biggest, I don't know, almost barriers to creating our patient-friendly terminology, because there really aren't a lot of tools out there. We used a few online ones, but Readability Studio was not one of them. Maybe it's something I need to look into.
Okay, so I think that is all the questions for right now. Thank you so much for attending. We're going to go ahead and close out for today. I hope you found the information in today's webinar useful. If you want to learn anything about IMO Core Periop, please contact your IMO client executive at sales@imohealth.com. Thank you so much, and I hope you have a great rest of your day.